Good morning, everyone. Our guest today is Dr. Ryan, and he will be discussing over-the-counter medications. Welcome, Dr. Ryan.
Well, welcome to you and all those who might be listening. I'm Dr. Rusty Ryan, and I'm a member of the Kansas City Medical Society Foundation Speakers Bureau. And we have about 10 to 12 retired physicians, and we give talks all over the city, generally about 50 talks a year to maybe 2,000 plus people. So we really enjoy giving back and making this a community service. And so we really appreciate this opportunity. Magda today has asked me to talk about OTCs, or over-the-counter medication. Um, there are hundreds and hundreds of over-the-counter medications that you will certainly see when you go to a pharmacy, just shelf after shelf after shelf. Um, and so today, what I hope to do is I want to maybe clarify fact and fiction related to medication myths that are associated with over-the-counter medications. You're welcome to ask questions at any time during the presentation. That doesn't disrupt me. Actually, I enjoy it. But here goes. So we'll just remember that the over-the-counter medication, herbs, supplements, things of that nature, they do not require a prescription from a doctor. And you can actually walk in a pharmacy and find an item that you want and buy it without a doctor's visit. Um, as I said, it's very confusing. You go and you look at the shelf, and there are just like 10 or 12 products on the shelf, and they all are the same thing. So, how do you kind of sort through that? Uh, and we'll talk about what I consider probably 8 main myths and or misconceptions related to over-the-counter medication in a drugstore. The background of my talk today, since I was a pharmacist originally and now a doctor, today's data, to at least add some substance to it, it comes from an article in which 350 pharmacists were interviewed. So this data about over-the-counter medication is totally related to what a pharmacist perceives in interacting with a customer who is there to purchase over-the-counter medications. And and starting off right in the U.S. News and World Report, there was a recent article, and it just appears that consumers believe too many myths about over-the-counter items and therefore often purchase the wrong thing for the malady that they have. And so hopefully today we'll be able to put a little that put that aside so that you don't really spend your money on something that's not going to help you. The um, the first item I wanted to talk about today is it's really a fiction, and I just stated name brand over-the-counter medications or products are clearly better than their generic versions. And that's totally false. I know I use CVS, so when I go to CVS and I look for an over-the-counter medication or some type of item, you'll see a brand name, and then you'll see something right beside it with a generic name. There is no evidence that the generic product is less effective or helpful than the name brand over the counter item. the over-the-counter brand name. Let's talk about brand names. Brand names are like Wonder Bread. Generic names are bread. Okay. So in essence, what happens is the reason people often pick the brand name product is because the brand name product is advertised and marketed totally. You see it on TV, you hear it on radio, it's in the newspaper, it's everywhere. So basically, you just are reminded or you know that name, but that product might be 12.50, but the CVS generic product right beside it that's just as good costs $10. So you could save $2.50 by simply using the CVS product that's identical. And if you look at the CVS item up in the far right column, it'll say same as, and then they'll list the brand name that you were about ready to reach for. So just remember that when you are shopping for over-the-counter items and there's a brand name there and there's also a generic name, then I would always choose the generic item. There are people in our practice who swear by the brand name versus the generic. And if they want that product and they want to pay that amount of money, then so be it. But I'm just telling you that normally buying the generic is just as effective as buying the brand name item. Um, but as I said, advertising and marketing, it's kind of like it's just there in front of us, and that's kind of what we remember when we walk in the store. The second item that I think is crucially important, that is also fiction and is not appropriate. It would say it's okay for children to take adult OTC medications as long as the doses are reduced. Now, that's not true. You should not be shopping for an OTC that's for an adult and then just kind of decide that, well, I'll give my child half the dose or a fourth the dose or whatever when I get home. That's a very dangerous thing to do because the adult products are made differently. And you should always, if you're shopping for something for a child, generally the children's um, over-the-counter items will more than likely be liquid because it's easier for them to swallow. If you try to give a child an adult tablet or an adult capsule, sometimes choking and very, very difficult situations can arise. So I would certainly not urge you to be giving your adult strength Tylenol tablets or capsules to your children when in fact there is a pediatric form of Tylenol or with a dropper. They have a dropper for that or a special item in the package that basically shows you the correct dose. So I would strongly say to you, don't be using adult medication products and dosage forms for children. That's really not appropriate. Um, Also, children need smaller doses, and generally, it's very difficult to break a capsule or break a pill and get the proper dose for a child. So that's just something that we shouldn't substitute adult forms to children. Are there any questions so far?
Well, I have a question. Maybe you will address it down the line. How about cutting pills in half?
Well, if you have a pill and you have a pill cutter, uh, uh, pills that are scored, which have a mark on them. Now you can actually do a good job of splitting those pills and get, I would say, probably 99.9% of the correct dose. But even then, maybe one half is different than the other, but not that much. I'll talk about that a little later in a little lengthier
Okay.
discussion. The next uh, uh, fiction issue is it's okay to double dose over the counter medications when I forget a dose. That's not a good practice at all, uh, because you get if you take double the dose, you get double the dose in 30 seconds to a minute, whereas that dose should actually be distributed in the body over a 4 to 6 hour period. It's probably the only place if you miss a dose, particularly if it's for pain medication. Now, there would be the reason for you, if you missed a dose, to take another dose, but take the dose that's prescribed, not double the dose. Okay. So, okay, you're taking something every 6 hours and you take the first three doses in a day, but you miss the fourth dose. Well, then you take the next dose 4 hours from when you missed it, but you don't double the dose or triple the dose to catch up. I hope that's clear.
Yes.
Uh, okay, so that's something that we need to be aware of, because I think there's you know about a very high incidence of non-adherence to medication when people miss doses on a daily basis. So just remember, this is not a good idea to be doubling the dose when you miss one. Now, the next thing is really almost a topic in itself, and it reads, natural or organic supplements are safer than other OTC medications. This is not true. Uh, that is, many of the natural or organic supplements can cause toxicity, uh, and so you have to be sure you take them as directed. The major difference between over-the-counter medication and generic medication, it's regulated by the Food and Drug Administration. That is, it has to pass tests before it can be released on the market. However, herbs and supplements, and there's I mean, the shelves are just full of these uh, various ginkgo or melatonin or garlic or various in sundry numbers of herbs and or supplements are on the shelves, but they're not regulated by the Food and Drug Administration, and so then you get into the issue of, since there's no quality control and or a regulation of the manufacturing of the product. You don't know exactly how much dose is in each capsule or tablet, uh, and you don't know the dissolvability of the tablet or capsule. So there's just and I'm not saying people don't take a lot of herbs and supplements and swear by them. And if in fact they choose to spend their money and they feel like that they're getting a result that they couldn't get from, say, prescriptions or from over-the-counter medications, and so be it. But I'm just saying you can't say, oh, this is just organic, or this is just a supplement, or this is natural, and expect total 100% safety, because there are all kinds of case reports of people coming to the emergency room that have been made toxic by some of these agents. So just remember that. And once again, I really, really hope that you're a label reader, because it's important that you read the label and that you use the dose that's recommended for your age group. And so in some instances, It'll say from 20 to 40, you take one. From 40 to 60, you take a half. From 60 to 80, you take a fourth, something like that. So you have to be very, very sure and don't get lulled to sleep that you're taking an organic or you're taking a natural supplement so there are no downsides. There really is no such thing as, quote, a safe medicine. Magda and I were talking before we started the presentation. If aspirin were discovered today by a research lab, it would be a prescription only prescribed by the doctor because the aspirin does so many things that can be great for your health, but also there are a lot of downsides related to people taking aspirin. And so we have to really monitor that very carefully. The other thing too that I don't think people appreciate, and I would being a pharmacist, I would really encourage you to develop a relationship with your pharmacist because there are so many questions you have about this particular area. Not only can organic or natural products be a problematic or even cause toxicity. But also, you may be on a drug regimen of 3 or 4 or 5 medicines, and you've been taking them for 25 years without any issues at all. And then you decide to buy a organic or natural product, and all of a sudden that will cause a significant drug interaction with the medicine you've been on for the past 25 years. So I would urge you when you start a new medicine, be sure before you leave the store that you just double check it with the pharmacist and make sure that it's compatible with what you're already on. And this is real. I will just give you a precaution. If you get all your medicines at CVS, then every time you get a new prescribed medicine, they will put that into the computer and they have an automatic software on the computer that looks for drug interactions with the new prescription. But if you're just taking an organic or natural supplement and then going up to the front of the store and checking out and take it home, then that information on the supplement does not get fed into the computer. Therefore, there's no way they can tell you whether or not there's a significant drug interaction. So once again, when in doubt, check it out. And that's actually, as a pharmacist, just to give you a little feedback, uh, I didn't get so much joy out of filling prescriptions, but I really got a lot of joy out of being able to talk to the customer patient and getting to know them and answering their questions so that they would feel more comfortable when they got home and were now medication is actually their responsibility.
I have a quick question when you are talking about interactions. How about grapefruit?
Grapefruit juice, there is one significant drug interaction that pops up when you say that, and that's with those people who have high cholesterols and they're taking what we call statins or lipid fat lowering agents. Uh, the grapefruit juice interferes with the metabolism of the statin, and therefore, let's say you're on, excuse me, you're on, say, 20 mg's of a statin. Well, maybe drinking a 8 ounce glass of grapefruit juice, that 20 milligram dose may actually become a 40 milligram dose, and therefore that's too much for you. So, in essence, it can either prevent the drug from totally being effective, and or it can increase the level of the drug so much that that maybe you even might could potentially become toxic. So grapefruit juice and the statins, excuse me, don't mix, and we recommend that you don't use those together. The next thing that is a practical issue that you may not think of, but talk a little bit about where you store your over-the-counter medications at home. Uh, a lot of people store them in the bathroom or in the medicine cabinet. That's not a good idea because the erratic temperatures and moisture in that room when you're taking a shower, or taking a bath, or using hot water or whatever, the moisture and the heat can actually impact uh, the efficacy of the tablet or capsule or whatever medication is in there. Best to keep your over-the-counter medication maybe in a cabinet in the kitchen. It just has to be cool and room temperature basically. You can store it in other places. Just remember, you if you have little people that come visit or they're in the house all the time, you have to be very, very careful and make sure you store your over-the-counter medications in a place where a child cannot access it, uh, because there so many of the over-the-counter medications, a very, very small dose of an adult medication over the counter can kill a child. So you want to make sure that you have your medication in a inaccessible place, or you have a lock, you have a tie on it, or you have a lock or something. But you just have to. That should be priority number one, not just where you're going to store it, but think in your mind. If I had a small person here and they were curious and they were looking in drawers or looking in cabinets or looking whatever, would this be safe? And so I would urge you to consider that first before you store your medications. But I would really encourage you not to store your over-the-counter medications in a bathroom in the medicine cabinet.
And it looks like candy to small children
Right.
because it's red and colorful.
And sometimes children's medicine will be in like gummy drops, and as Magda says, it's beautiful candy. It may be bright colored, it may be speckled, it may tease the little fingers to go and see what it's like.
Mhm, mhm.
So that's something that is practical, that has to be said, related to the actual duration of whatever the expiration date is on the medication. And leading into that, get a lot of questions about expiration dates, uh, and if you get a product off the shelf and you will take a look at it, read the label. On the label, it will say on there, somewhere on the bottle, label, top, bottom, whatever, the actual expiration date of that particular medication. Now, what that expiration date means is that's the date at which the manufacturer will no longer take responsibility for the full benefit and efficiency of the product. However, if you've taken good care of that medication in an appropriate storage, and it hasn't been mistreated, more than likely you could take that medication another couple months or 3 months until you replace it with a fresh bottle of the medication. And so that comes up a lot, and so just remember that, if you're somewhere where you can't get a refill, or you're nowhere you can get the medicine purchased right away, or maybe it's you're getting a mail order or something like that, you can go ahead and take the medication for the next 2 or 3 months. More than likely, it's almost totally good, related to the actual use of it. But beyond that, then you need to begin to think of getting something and replacing it. Uh, Anytime you are looking at the medication, and uh, the tip-offs related to uh, tossing it would be if it if the product seems to be disintegrating, or becomes discolored. You know, you have a white tablet, now it's kind of turning brown or another color. Then you would stop right there and replace it with a new product. The other thing too, related to this, that may save you any medication expiring. If you know you're only going to be taking the medicine for a short while, then get a small bottle. Obviously right there by the small bottle is like a big bottle that's quote of value, related to, if you extrapolate what the little bottle cost and then what the big bottle costs. But the big bottle, you may not use hardly any of it, and it expires and you've paid a lot more for it. So you can get a little unit bottle, and be sure that the medication is working. The next thing is something that does come up quite often, is that gel caps are worth a much higher price versus capsules and tablets. This is not true. The gel cap doesn't work any better than the tablet or the capsule. And when people just pull the gel cap down thinking it's better, that's just fiction. Um, the only thing is, there are some people that have really difficulty in swallowing tablets and capsules. And for a reason, these people seem to be able to swallow the gel caps much easier. And
Mhm.
so if the person is not going to take their medicine because they can't swallow the capsule or tablet, then buying the gel cap, which is a little more expensive, makes sense. But otherwise, the gel cap versus the tablet versus the capsule, the gel cap's greater expense does not make a lot of sense for most people. And now we get to Magna's uh, topic of cutting tablets. Uh, the statement, which is fiction, it's okay to cut, crush, or chew over-the-counter pills. Now, uh, this is where you have to be observant, because you may be getting an over-the-counter medication that says extended release or sustained release. And in that case, those products should not be uh, uh, cut, crushed, or chewed. The reason for that is that these medications, like extended release, they're like you take a pill and it releases the medicines over 12 hours or even over 24 hours. So if you cut, crush, or chew something like this, you're giving yourself a 12-hour dose in 30 seconds, or a 24-hour dose in 30 seconds. So, so your blood level just skyrockets related to that particular drug. So you do not want to be cutting, crushing, or chewing any type of extended capsule or tablet. Now, as I mentioned earlier, there are a lot of tablets in particular. And what I have is I have actually a tablet cutter, that you could buy in the pharmacy, and you just slip the tablet in there. We call it scored. That is, generally you have a tablet on the back side, it's scored. On the front side, it usually has a code, like 2C or 10 or 26. The code is helpful to the pharmacist because if Magda came into the pharmacy and said she found this medication and the doctor said to start taking it and she didn't know exactly what it was, if she brought the tablet in and showed it to me, then I
Mm-hmm.
have a book and I
Mm-hmm.
can look it up and find out what medication Magna should get.
Mm-hmm.
So on the backside is the score, and if you don't have a cutter, actually you could even I just sometimes I just pop them, with my fingers, and they pretty much when they're scored they break pretty neatly. But I would certainly urge you to get a pill cutter, which is just a single little razor blade inside. You slip the tablet in, close the lid, and bingo, you have something that's uh, divided. That's equidose. Um, so I think, related to other things that I would urge you to do related to this area of over-the-counter medication. I would hope today that I've kind of tried to convince you that just because you buy a medicine over the counter and don't have to talk to the pharmacist or talk to a doctor or nurse, that it's safe and you can just go on your merrily way and not be concerned. Um, I think just from a pharmacy and even a doctor standpoint, I think I would highly encourage you to at least pass it by the pharmacist related to before you leave the store, just because there may be some idiosyncrasies that you don't know about. For instance, there are medications that may turn your urine red orange when you get home. And certainly that may be of great concern to you because you may think you're bleeding from.
Unless you eat beets.
Yeah, right. Exactly. There are a lot of different things that can stain your urine, and medications is one. So I would highly urge you to just take a few minutes and have the pharmacist just kind of give you a second opinion related to what you're thinking. I need this. I'm not sleeping well. I have pain in my knee. I've got itchy eyes and a runny nose. Just a lot of symptoms that you would actually just not want to bother the doctor's office or anybody about because you think you can handle it yourself. But at the same time, it might be helpful if you just had a little additional information from the pharmacist to actually get the best result from the medication that you are choosing yourself from advertising or a lot of times people, family members, friends who have had similar symptoms say, "Oh, I took so and so and it really worked for me," and then you rush to the drugstore to get some of it. But I just think that over-the-counter medication can be very helpful related to symptoms. It may save you from a visit or an appointment to a doctor's office or emergency room or urgent care center. But at the same time, if you get all the information you need at the pharmacy, more than likely you can handle it at home on your own because you're the best monitor of what's going on with you, whether it's something or nothing. So I think I'm going to stop right here. And if anybody has any questions about anything that's been said or You
I
had
have a
particular.
comment to make because really about pharmacists. So my appreciation for pharmacists skyrocketed when a relative of mine was in ICU with a traumatic brain injury after an accident, and they were these daily morning uh, audiences or whatever it's called with all these specialists, all these, doctors, high specialists, and including a pharmacist. And everybody was looking up to the pharmacist, asking this drug, the other drug. So, he was the main go-to person, was the pharmacist. So my appreciation skyrocketed for pharmacists.
Sure. Yeah, so many, the education of a pharmacist today is totally different than it was 50 years ago. When I was in pharmacy school, we were all of our, other than our book learning, when we went to our laboratory, what we did is we made things. We made ointments, we made creams, we made suppositories, we made capsules, we made tablets, and we even put medicine in ampules so that it could be injected eventually in either intramuscularly or intravenously. Nowadays, the pharmacist education is predominantly book learning, but also they have experiences generally in their senior year and or do residencies in which they do, just like Magna said, they actually round with the doctors and see the patients. And therefore, they are the quote drug expert on the team. And so the doctor and pharmacist and nurse have interplay. And I think using the best knowledge of all three persons, I think that the patient gets the best care that they possibly could get because they have experts in diagnosis, experts in caregiving, and also experts in the medication that's being administered.
Well, there are still a few compounding pharmacies. A friend of mine works at Stark Pharmacy. I
Yes.
believe it's on the row. And I think about a decade ago, the pharmacists had their education included PhD. So it
Uh-huh.
takes many, many, many years to become a pharmacist now.
Yeah, I know Mr. Stark very well, and in particular, most of the compounding pharmacies today, generally they have they're in maybe a clinic with, say, a dermatologist. Since the dermatologist prescribes so many ointments and creams that need to be compounded, generally a specialty, they call them specialty pharmacies. They are pharmacies that get a prescription from a dermatologist and then they compound them, much like I did 50 or 60 years ago. Uh, and the downside is that when it takes that kind of time to actually compound an ointment or cream, sometimes they can be fairly pricey
Mm,
versus other types of dosage forms.
mm. Well, some physicians still prefer them and for special, and they subscribe them for special circumstance,
Yeah,
you know?
hormone. They do hormones.
Yes, hormones. Uh-huh.
Are very common. Some may be for cancer patients, particularly related to a cancer patient that can't swallow medications, as though they have to use ointments or creams or other dosage forms. So yeah, the
Mhm.
specialty pharmacy is a very valuable asset,
Mhm.
particularly related to individuals that can't just swallow their medication.
Mhm. Or dermatologist. My dermatologist still uses compounding pharmacy.
Yes, that's for sure. That is for sure. Yeah.
Well, all right. Thank you so much for Dr. Ryan. This was wonderful, informative, and thank you so much for taking the time with us.
Well, I'm glad to do it, and I hope it helped. And if you said you might get some questions later after we close, if so, if you just forward those to me, I could maybe follow up with you, and you could send them to whomever might want to listen to it.
Thank you. Very generous of you. Thank you. Have a nice day. Thank
Okay,
you.
thank you. Uh-huh. Bye.